Hello, everyone. I'm Vanessa Grossel, Policy Analyst at the Council of State Governments. I serve as a staff liaison to CSG's Healthy States National Task Force, which is comprised of 4 subcommittees examining such topics as capacity, preparedness, and resiliency, leveraging innovation, state health systems return on investment, and interventions to save lives. I'm joined today by Miranda Creviston-Motter, Senior Vice President of State Affairs and Policy at America's Health Insurance Plans, to talk about how the health insurance industry has been responding to COVID-19. Miranda joined AHIP as Senior Vice President of State Affairs and Policy in April, a role in which she is responsible for AHIP's state policy and advocacy agenda, as well as AHIP's political engagement strategy with state officials, regulatory agencies, and key policymakers. Prior to joining AHIP, Miranda was the president and CEO of the Ohio Association of Health Plans for over 8 years, where she provided thought leadership on policy initiatives that drove improvements for access to high-quality, affordable health care for more than 9 million Ohioans covered by OAHP's 15-member health plans. And prior to her work at OAHP, Miranda practiced law for over 10 years and has served as staff to former Governor George Voinovich and former U.S. Senator Mike DeWine, who is now Governor of Ohio. Welcome, Miranda. Tell us more about AHIP.
Thanks, Vanessa. Thanks so much for having me today. And I'm really excited about the opportunity to share with you today about AHIP and some of the work that we are doing. AHIP is the national association whose members provide coverage for healthcare and related services to hundreds of millions of Americans every single day who may be purchasing their healthcare through their employer, maybe from individually on their own, or they may be accessing and purchasing healthcare through a public program like Medicare or Medicaid. And so it's really through these offerings, through this health insurance coverage, that we improve and protect the health and financial security of consumers, of families, of businesses, and communities across the country. AHIP and its members are committed to market-based solutions and public-private partnerships that improve affordability, value, access, and well-being for consumers.
So let's dive in. Tell us, how have health insurance providers responded to the COVID-19 crisis?
Thanks, Vanessa, for that great question. Certainly, responding to the global pandemic has been paramount to what the health insurance industry has been focused on. Let me first start out by saying that we believe that every American deserves affordable, comprehensive coverage that provides them with access to high-quality healthcare. It's critically important. And I think the global pandemic has really demonstrated this in a very clear way, and that it's essential to assure that Americans' coverage remain stable, both from an access and affordability perspective, as much as possible, that an individual can end the year with the same coverage that they started the year with. And so understanding that, health insurance providers responded very decisively, very quickly to help Americans overcome the COVID crisis. In February, AHIP and our member plans began working very diligently with the CDC and health experts across the nation to share information, to mitigate health risks to Americans, and to actually keep Americans informed. And so what does that mean on the next level? Early on, health plans were carefully monitoring the situation. They were following their emergency preparedness plans, which are essentially plans that are always in place to address situations that include global pandemics. Those plans include determinations about whether insurance policy changes are needed to ensure that people can get essential care. So they may include things like easing network requirements, prescription drug coverage, referral requirements, and or cost sharing relaxations. Plans at that time were also actively educating people on steps that they could take to prepare and stay healthy. And they directed individuals to the CDC for that critically important information. They began tracking symptoms and patterns that may have been apparent through data that they received on and through electronic medical records and phone calls to nurse call centers and clinical visits. They were informing clinicians to ensure that they know what the symptoms and knew what the symptoms of COVID-19 look like and how to actually address those things early on. And then very early on, we began collaborating with federal agencies and local public health officials to help contain those outbreaks as they started. So shortly thereafter, that work began. And in early March, AHIP's board of directors committed to helping America's powerful health care system meet the challenges. So we are in a country that is benefited by a very strong healthcare system. And so very early on, we started that work. And so with the health and the well-being of the people that we serve as our highest priority, health insurance providers began on activating those strategies to ensure that Americans had access to prevention, to testing, and to the treatments that were needed. So let me give you some examples of that work. Health insurance providers were and are currently, as this pandemic continues, working with public and private sector partners to ensure that costs are not a barrier to people seeking testing for and treatment of COVID. So insurance providers, they are actively covering diagnostic testing. They have eased network requirements and referral requirements and prior authorization requirements. They are waiving patient cost sharing. Health insurance providers are also making sure that patients have continuous access to their regular prescription medications, while at the same time avoiding potential problems such as drug shortages, which is very important. Health insurance providers are also partnering with doctors and hospitals and other care providers to ensure that effective treatment is available for those that are infected. As I said earlier, we continue to share information with clinicians. They're mobilizing their network providers and coordinating through care management programs that health plans have to ensure that they have the best and most immediate data to help identify and diagnose and treat the infection. And I'll talk a little bit later on, but health insurance providers are also encouraging the use of telehealth, at-home care, other technologies that expand access to care, but at the same time are helping Americans avoid being exposed to or at risk for catching the infection. Health insurance providers continue to educate and inform the people that we serve. We continue to work directly with the important federal agencies, so the CDC and other task force and our essential partners in the states and the cities and the communities across the country, which are doing such important work, coordinating efforts and sharing information and really mitigating the health risks and keeping Americans informed and safe. The other thing that I will mention in terms of our work, certainly as it has focused on prevention and testing and treatment work that I just talked about, the other work that health insurance providers have been doing is ensuring that the Americans can continue to get the care and the medications that they need to address maybe some health conditions that they currently have. So it's not only been focused on making sure that Americans get the care that they may need if they get infected, or helping them to prevent from getting infected from the COVID virus, But health plans have been working very diligently to make sure that Americans that may have a chronic condition or may have another disease that they have been dealing with, to make sure that they can continue to get that care and the medications that they need. So we are pleased and we're proud to be standing alongside of our partners and devoting resources and insights and collaborating with key partners to confront and resolve this challenge together.
So, how has AHIP worked with Medicaid programs in the states as well as other stakeholders to ensure access to affordable, high-quality care leading up to and also during the pandemic?
Yes, that is a great question as well, because Medicaid and Medicaid programs are such an important critical access point to so many Americans for their healthcare coverage. Medicaid helps millions of Americans every day. We know that. It is the largest healthcare program in the United States, currently covering more than about 20% of the U.S. population. What we do know is that Medicaid programs are the lifeline for about 1 in 5 Americans, including children and pregnant women, elderly adults, and individuals living with disabilities. We all know that Medicaid programs need to be there to support these Medicaid enrollees. Across the country, as is the question that you asked in terms of how have we been helping Medicaid programs and how has the industry been helping Medicaid programs leading up to COVID. Across the country, states are increasingly relying upon Medicaid plans and private industry to help promote high quality, coordinated care for their growing populations. More than about 56 million low income individuals actually rely upon private health plans, so Medicaid managed care plans, to provide their Medicaid coverage today. And those plans have been and continue to provide a variety of services to meet the new unique needs of individuals in our Medicaid programs across the country. Those programs include coordinating care for individuals that may have multiple chronic conditions. So they may need care coordination and help managing through multiple conditions and multiple providers. Those programs also include outreach and education initiatives to promote prevention and healthy living, and efforts to actually help beneficiaries access what we would consider non-medical support. So actually helping individuals get transportation to get to that doctor's appointment, or food to make sure that they have a healthy lifestyle or healthy living that will help them better and improve that healthcare need that they may have. So that being said, in terms of the work that we have been doing up to COVID, let me also sort of take a step back and say that, our governors across the country have taken widespread, bold actions to respond to this COVID crisis. And we know that their strong actions have helped businesses and workers and patients and providers. Now as governors are turning their attention to, reopen their states and try to rebuild their economies, we really believe, the health insurance industry really believes, that access to affordable healthcare coverage is critical to restoring a state's health and economy. And we also believe that Medicaid programs are uniquely situated to serve and help boost states' economic engines. So as businesses reopen, we know that employers want to have access to healthy workforces, and that means unemployed citizens need to have access to healthcare and healthcare coverage, health insurance coverage. And so, we believe that Medicaid safety net programs are really providing this access to care and are important linchpins. But at the same time, we also know that states are being pushed to the brinks. Despite temporary enhancements of federal matching dollars, which you may have referred to as FMAP, federal assistant percentages dollars that the federal government provides states to help them operate their Medicaid programs, it was really probably not enough in terms of helping them cope with the numbers of individuals that states are seeing come on their Medicaid programs. Significant unemployment and losses in tax revenue and increasing Medicaid enrollment are all taking a heavy toll. So that being said, a lot of the work that we have recently been doing to help support Medicaid programs to make sure that there continues to be access to affordable coverage to not only those Medicaid recipients that have been on Medicaid, but also those individuals across the country that may have lost a job. AHIP has been really active and helping some efforts to make sure that we have a financially viable, stable Medicaid program across the country. Just a couple of examples of that work. We have recently requested congressional support for a number of recommendations that would ensure that state Medicaid programs were financially sustainable. We also joined a number of national organizations representing patients and healthcare providers, health insurance providers, and other stakeholders to urge Congress to support additional federal financing for state programs to help them continue that sustainability and that support that we know that we need. We also continue to work with governors and insurance commissioners and state Medicaid directors across the country to regularly engage with them on COVID-related concerns, talking to them about best practices, providing policy recommendations that, again, would help to assure and go a long way in making sure that those programs are strong and financially viable and really value-driven state programs.
And earlier you mentioned telehealth. With COVID-19's rapid onset, a dramatic shift to telemedicine and telehealth for behavioral health services and many other services has occurred. What has AHIP done to facilitate that transition?
So I'm glad you asked about telehealth. As you said, this has been an area of dramatic growth. We have seen that really since the start of COVID. I will tell you that health insurance providers have long promoted the use of telehealth because it is effective, it is convenient, and it's really a safe way for many Americans to receive their health care. I think as we've seen, COVID-19 has really demonstrated, quite frankly, how valuable COVID is and can be. Early on, health insurance providers began waiving and have waived cost sharing for telehealth so that cost is not a barrier to that service. Many health plans also expanded telehealth programs so that more individuals and more types of services could be available via telehealth. And so we're really excited to facilitate the care and that type of care for so many Americans. It's interesting. So, telehealth is, as you probably know, is especially beneficial, particularly during COVID, for patients who may be at higher risk, and are nervous or are sensitive and are concerned about leaving their home to go to a doctor's office. For doctors during COVID, expanding telehealth has eased the burden on the healthcare system. It has allowed for hospitals to care for those people who need it while limiting the exposure of healthcare workers, those heroes and those frontline workers from additional individuals that may be coming into those facilities. And that the other thing is that it has also meant is that for providers and some hospitals, they have been able to stay in business because they can continue to see patients who need care, during the COVID pandemic. So again, we're really excited to see how the technology is being used, how it has really just exploded. And from a health insurance provider perspective, we have really been using it from, addressing mental health issues, from reducing opioid misuse and abuse, to supporting seniors and others that may have, mobility, transportation issues. And so it's really an exciting model to see develop and being used. I will tell you that during this crisis, AHIP and our health plan members have really supported a number of the policy changes that were made by both the federal government and in states by state policymakers to encourage the use of telehealth and to speed its adoption. And so, now we're really excited about this conversation, and as we're beginning to come through COVID, and I think as hopefully once we get to post-COVID, we can really look at what our healthcare system looks like and how telehealth has really transformed that, and really take away, I think, some of a lot of the value that we have seen through telehealth, begin to bring telehealth into the environment when you think about value-based purchasing and really using telehealth to drive outcomes in the way that we have so many other types of delivery systems. So we're really excited about that continued use.
Great, thanks. And could you explain how AHIP has worked in the field of COVID-19 testing, including advocating for its affordability?
Yes. So testing has been incredibly important. And I appreciate the question about advocating for its affordability. As I said, I think, during this unprecedented time, we all recognize and all acknowledge that widespread testing that is safe, that is effective, and that is accurate is just incredibly important. It's so necessary. And there really are two essential components that we have seen to testing. First, we really must be able to quickly diagnose the virus. And then second, we really must be able to screen and prevent and mitigate the spread of the virus. And so we see that, early on, I think the testing was primarily being used for diagnostic purposes. And I think we have quickly sort of seen testing now being conducted for three different kinds of purposes. The first, for diagnostic, meaning to guide care and treatment. The second type of testing that we have really seen being used across the country by governors and states and localities is for public health surveillance purposes. And then lastly, for occupational health. So as individuals are returning to work, with hopefully schools opening in the fall and return to school, we see and hear about testing being used for those purposes. So looking at the sort of different purposes, let me say that we also believe that access to testing should not be dependent upon anybody's ability to pay. To your question about affordability, health insurance providers are committed and have been committed to removing cost barriers for COVID-19 diagnostic testing. And plans have been very proactive in eliminating co-pays and co-insurance and deductibles for that type of testing. Health insurance providers have also waived primary or prior authorization requirements. Those requirements that may have been in place, those have been waived for patients that are seeking testing or treatment of COVID so that they can actually get, faster access to that care. But let me say that knowing the scope and the breadth of the testing that is needed across the country as we look at the other two types of testing, so for public surveillance and occupational health, the exceptional scale and scope that is required, public health testing efforts and public health and occupational testing really needs to be a national priority, be federally funded, but locally administered. And so to that end, as we have been making sure that our members have access to diagnostic testing for care and treatment, we have also been active as part of a number of other national stakeholders in seeking additional guidance and additional federal investment in states for testing, for public surveillance, and for return to work, return to school, so that occupational health, so that we can make sure that all Americans, again, have access to the critical testing that they need, and it can be available to them in an affordable way.
All right, thank you. And how have considerations such as social determinants of health influenced the work of AHIP?
Yeah, so social circumstances have a huge impact on a person's health. So I'm so glad that you asked that question. We hear lots of times that not every health issue can, or quite honestly should, be addressed with a prescription pad. I think health insurance providers have really known this for years, and really is why we have focused on programs to take care of the whole person. So what does that whole person care mean or look like? It really means looking at caring for that person from a food security or a healthy food perspective, from taking care of that person from a transportation perspective. So making sure that, they may have a doctor's appointment that they need to get to for a healthcare issue, but if they don't have the transportation to get there, that becomes a real gap in that person's healthcare. Safe housing. Safe housing can be just as critical, if not more critical, than that person's underlying healthcare condition. And so, in the midst of COVID, with so many Americans being isolated in their homes and millions being unemployed, I think the need, and I think we believe as an industry that the need to address, issues like I talked about, from food security, insecurity, to housing instability and social isolation, is, unfortunately greater than ever before. We also know that disadvantaged and minority communities are experiencing higher rates of infections and death from the disease, as well as greater economic impact from social factors that are challenging in normal times, and unfortunately have been amplified during, the global health crisis. So to that end, health insurance providers are and have been, very actively engaged with local healthcare and social service providers to address social economic needs. Again, food security, employment, and housing issues. We really believe that these programs are just fundamental to our commitment to improve the health and well-being of the Americans that we serve. And I'd be happy to point the listeners to a variety of materials that I do know that we have on our AHIP website We have a number of recent briefs that we have done that really describe at a very specific plan and program level some of the really unique and neat things that health plans are doing to make sure that their members have food, that their members have jobs and can get connected to employers, and make sure that they are getting the services that they need if they're in isolation or in recovery sites. So we're really excited about that work. Again, I'm so happy you asked about that question because we really understand and truly believe how important it is to a person's overall health.
So you have shared so much great information, and I'm just wondering, what does all of this mean for state policymakers? And what kind of policy considerations would AHIP like for legislators to bear in mind as they work toward state solutions in the months and years ahead?
Well, thank you for that question too, Vanessa. We really appreciate the work and the partnership that we have working both with our state policymakers and leaders that are on the front lines of this, and in addition with the federal leaders, from everything to our work and support from supporting our healthcare heroes on the front lines to supporting testing and treatment strategies and helping businesses and their employees continue coverage. And so, the question about sort of what's next in the policy and the regulatory solutions that we may need moving forward, I think there are a couple of important things to keep in mind. I think first, we should really seek to adopt improvements for care and access while improving affordability wherever we can. And, sometimes I think, it's just so important to make sure that you keep both access and affordability in mind when you're thinking about policy solutions. Because sometimes if a service isn't affordable, it means that it's not accessible, right? And so those two things go hand in hand. I think a perfect example of that is telehealth. When you think about policy changes for telehealth, patients and doctors, we know are all realizing the benefits of expanded telehealth. And as we talked about earlier, as I said, growth in telehealth has exploded during this pandemic. And moving forward, as we look at policy changes and policy reforms, I think it's just so important that we need to make sure that we continue to promote innovation, that we continue to embrace the cost-saving potential of those services and effectively leverage telehealth to deliver that outcome-based value care that I talked about earlier. I think the other thing we need to is to really begin instituting important safety and affordability measures that were waived to speed care during the pandemic, but are critically important to patients and employers and taxpayers. So, making sure that we continue to fight against fraud, waste, and abuse. And some of those important tools are continued use of medical management and prior authorization, and really looking to how do we incorporate some of those important tools back as we come out of COVID. So the only other thing I would just say is to just really be cautious about some of the short-term policy decisions that may have long-term unintended negative impacts. And so we stand ready at AHIP and through our work in the states and at the federal level to partner with policymakers. And we're really excited, I think, about opportunities that we see in the future to make sure that we can continue to provide access and affordable, high-quality care for the Americans that we serve.
Thank you for joining us today, Miranda. We appreciate you for making time to share your expertise with us. It will help greatly to inform the work of our Healthy States National Task Force. I'm Vanessa Grossel at CSG headquarters in Lexington, and I've been speaking with Miranda Motter, Senior Vice President of State Affairs and Policy at America's Health Insurance Plans.